Infectious diseases are a major global health concern, posing significant threats to individuals and communities. This presentation will provide an overview of the key aspects of infectious diseases, including their causes, how they spread, and the strategies used to prevent and manage them. Understanding the fundamentals of infectious diseases is crucial for developing effective public health policies and interventions. By the end of this section, you'll have a better grasp of the challenges posed by infectious diseases and the approaches used to address them. Infectious diseases are caused by the invasion and multiplication of harmful pathogens like bacteria, viruses, fungi, or parasites within the body. These pathogens can spread from person to person, infecting the host and disrupting the normal functioning of the body's systems. Infectious diseases are often contagious, meaning they can be transmitted through direct contact, contaminated surfaces, airborne particles, or other modes of transmission. The immune system responds to try and fight off these invading pathogens. Pathogens are disease-causing agents that can be classified into four main types: bacteria, viruses, fungi, and parasites. Bacteria are single-celled microorganisms that can reproduce rapidly and develop resistance to antibiotics. They cause a wide range of infectious diseases like strep throat and tuberculosis. Viruses are microscopic infectious agents that can only replicate inside living cells. They cause diseases such as the common cold, influenza, and HIV/AIDS. Fungi are eukaryotic organisms that include yeasts, molds, and mushrooms. Fungal infections can affect the skin, nails, and internal organs like athlete's foot and candidiasis. Parasites are organisms that live on or inside another organism, the host, and derive nutrients from it. They can cause diseases like malaria, giardiasis, and toxoplasmosis. Understanding the different types of pathogens is crucial for developing effective prevention and treatment strategies. The immune system is a complex network of cells, tissues, and organs that work together to protect the body from harmful pathogens like viruses, bacteria, and fungi. It plays a crucial role in preventing and controlling infectious diseases by launching a multifaceted response when it detects a foreign invader. This response involves activating various immune cells, including white blood cells, to identify, attack, and destroy the pathogens. The immune system also creates memory cells to recognize and respond more quickly to future infections. The image on the right provides a detailed illustration of the key components of the human immune system. Respiratory infections like colds, flu, and pneumonia are extremely common and spread through coughing, sneezing, and close contact. These are typically caused by viruses and can lead to symptoms like congestion, fever, and difficulty breathing. Gastrointestinal infections like food poisoning, gastroenteritis, and cholera cause symptoms like diarrhea, vomiting, and abdominal pain. These are often caused by bacteria, viruses, or parasites contracted through contaminated food or water. Skin and soft tissue infections like cellulitis, impetigo, and fungal infections can manifest as rashes, sores, or irritations. These are usually spread through direct contact or poor hygiene and can be caused by various pathogens. Respiratory infections are a major public health concern, as they can range from mild to severe and can be particularly dangerous for certain populations. Influenza is a highly contagious respiratory illness caused by the influenza virus, characterized by symptoms like fever, cough, sore throat, and body aches. It can lead to severe complications, especially in high-risk individuals. COVID-19 is the ongoing pandemic caused by the SARS-CoV-2 virus, which primarily affects the respiratory system and can lead to a wide range of symptoms, from mild illness to severe pneumonia and acute respiratory distress syndrome. Pneumonia is an infection of the lungs that can be caused by various pathogens, including bacteria, viruses, and fungi. It can range from mild to severe and can be particularly dangerous for the elderly, young children, and individuals with underlying health conditions. It's important to be aware of the symptoms and potential complications of these respiratory infections and to take appropriate preventive measures and seek medical attention when necessary. Gastrointestinal infections are a common and serious health issue caused by bacteria and viruses like E. coli, Salmonella, and norovirus. E. coli is a widespread bacterium that can lead to severe gastrointestinal problems, including diarrhea, cramps, and in some cases, life-threatening complications. Salmonella is a group of bacteria that causes salmonellosis, with symptoms like diarrhea, fever, and abdominal cramps. It's often contracted through contaminated food or water. Norovirus is a highly contagious virus that causes acute gastroenteritis, with symptoms such as nausea, vomiting, diarrhea, and abdominal pain. Norovirus outbreaks are common in closed environments like nursing homes and cruise ships. These infections can have serious consequences, so it's important to be aware of the risks and take preventive measures. HIV is a virus that attacks the immune system, leading to AIDS if left untreated. It spreads through unprotected sex, shared needles, and from mother to child. Hepatitis B is a liver infection caused by a virus. It spreads through contact with infected blood and bodily fluids and can lead to serious liver problems if not managed. Hepatitis C is another liver infection caused by a virus. It mainly spreads through sharing needles for drug use, but can also spread through unprotected sex and from mother to child. These are all serious bloodborne diseases that can have devastating health consequences if not properly prevented and treated. It's crucial to understand how they are transmitted and take the necessary precautions. Sexually transmitted infections, or STIs, are a group of infectious diseases that are primarily spread through unprotected sexual contact. These can include common infections like chlamydia, gonorrhea, syphilis, HIV, and hepatitis. STIs are commonly transmitted through vaginal, anal, or oral sex, as well as the sharing of sex toys. They can also pass from mother to child during pregnancy, childbirth, or breastfeeding. Symptoms can vary widely, from no symptoms at all to painful or unusual genital discharge, sores, rashes, or burning during urination. Regular testing is important as many STIs can be asymptomatic. Practicing safe sex through condom use, limiting partners, and regular testing are crucial for preventing the spread of STIs. Vaccination is also available for some infections like HPV. Infectious diseases can emerge or re-emerge due to the ability of pathogens to adapt and evolve over time, allowing them to overcome previous immunity or treatment methods. Shifts in environmental conditions, such as climate change and deforestation, can disrupt ecosystems and create new opportunities for infectious diseases to spread into previously unaffected populations. Increased global interconnectedness and travel can facilitate the rapid spread of infectious diseases, allowing pathogens to traverse geographic boundaries and reach new host populations. The overuse and misuse of antimicrobial drugs has led to the emergence of resistant strains of pathogens, making them more difficult to treat and control. The slide outlines key factors that contribute to the spread of infectious diseases, including population density, environmental changes, antimicrobial resistance, and global mobility. Population density enables rapid transmission, as close contact and shared environments allow pathogens to spread more easily between individuals. Environmental changes like climate change, habitat destruction, and urbanization can disrupt ecological balances, leading to the emergence or re-emergence of infectious diseases by altering the distribution and behavior of disease vectors. Antimicrobial resistance, caused by the overuse and misuse of antimicrobial drugs, makes infectious diseases more difficult to treat and control. Increased international travel and trade have facilitated the rapid global spread of infectious diseases, as pathogens can be easily transported across borders and continents. These factors highlight the complex and interconnected nature of infectious disease spread, which requires a multifaceted approach to prevention and control. High population density in cities allows infectious diseases to spread rapidly through close contact and shared public spaces. Increased global travel networks enable pathogens to quickly move between regions and continents, leading to outbreaks in new areas. Interconnected trade, migration, and tourism increase the risk of infectious disease transmission across the world, making containment more challenging. Climate change is leading to shifting weather patterns, including prolonged droughts that deplete water resources and devastate agricultural lands. This environmental stress creates ideal conditions for certain infectious diseases to proliferate, especially in arid regions. Rising global temperatures are causing glaciers to melt and oceans to thermally expand, leading to sea level rise. Coastal communities face increased flooding risks, which can disrupt sanitation systems and contaminate water supplies, facilitating the spread of waterborne illnesses. Deforestation and habitat loss disrupt the balance of ecosystems, bringing humans into closer contact with wild animals and increasing the potential for zoonotic diseases to cross over. These environmental changes pose significant public health challenges that require comprehensive strategies to address. Climate change is leading to shifting weather patterns, including prolonged droughts that deplete water resources and devastate agricultural lands. This environmental stress creates ideal conditions for certain infectious diseases to proliferate, especially in arid regions. Rising global temperatures are causing glaciers to melt and oceans to thermally expand, leading to sea level rise. Coastal communities face increased flooding risks, which can disrupt sanitation systems and contaminate water supplies, facilitating the spread of waterborne illnesses. Deforestation and habitat loss disrupt the balance of ecosystems, bringing humans into closer contact with wild animals and increasing the potential for zoonotic diseases to cross over. These environmental changes pose significant public health challenges that require comprehensive strategies to address. Antimicrobial resistance is a growing threat that undermines the effectiveness of our medical interventions. Pathogens can rapidly evolve resistance to antimicrobial drugs through genetic mutations, making them harder to treat. Widespread and inappropriate use of antibiotics in both human medicine and agriculture has accelerated the development of resistant strains. Adherence to guidelines and responsible prescribing practices are critical to addressing this issue. Antimicrobial resistance is a global crisis that requires international cooperation and a coordinated public health response to prevent the spread of untreatable infections. Infectious diseases can spread through direct physical contact, such as touching, kissing, or sharing personal items with an infected person. This is a common transmission method for conditions like the common cold, influenza, and various skin infections. Certain pathogens can spread through the air, traveling in tiny droplets or aerosols expelled by an infected individual during coughing, sneezing, or even breathing. This is a key mode of transmission for respiratory infections like measles, tuberculosis, and COVID-19. Infectious agents can also be transmitted indirectly by touching surfaces or objects that have been contaminated by an infected person. Examples include doorknobs, tabletops, shared utensils, and even money. Proper hand hygiene is crucial to prevent this type of transmission. Infectious diseases can spread through various modes of transmission, including direct physical contact, airborne transmission, vector-borne transmission, and foodborne transmission. Direct contact refers to the spread of diseases through touching, kissing, or sharing personal items with an infected person or their bodily fluids. Airborne transmission occurs when pathogens linger in the air and are spread through respiratory droplets expelled when an infected person coughs, sneezes, or talks. Vector-borne transmission involves insects like mosquitoes, ticks, and fleas that can pick up and transmit diseases from one host to another. Foodborne transmission happens when contaminated food or water carries infectious agents that are then ingested, leading to gastrointestinal infections. Poor food handling, preparation, or storage can create opportunities for pathogens to enter the body. The incubation period is the time between when someone is exposed to a pathogen and when they start showing symptoms. This can vary greatly from a few hours to several weeks, depending on the type of infection. Infectivity refers to how easily a pathogen can spread from one person to another. Some infections are highly contagious and can spread through close contact, airborne droplets, or contaminated surfaces. Others have lower infectivity and require more direct exposure. A pathogen's method of transmission, the host's immune response, and environmental conditions can all affect its infectivity. Understanding these factors is crucial for implementing effective prevention and control measures. Infectious diseases can present with a variety of common symptoms, including fever, cough, sore throat, body aches, fatigue, and rashes. These symptoms can vary depending on the specific pathogen causing the infection. Prompt recognition of these symptoms is crucial for timely diagnosis and treatment. Diagnostic tests like blood tests, cultures, and genetic analyses play a vital role in identifying the causative agent. These tests can detect the presence of pathogens, measure their levels, and determine their susceptibility to different treatments. Imaging techniques, such as X-rays, CT scans, and MRI, can help visualize the internal effects of infectious diseases and assess the extent of organ involvement. Specific patterns observed in these imaging tests can also be indicative of certain infectious conditions. Recognizing the early signs of infectious diseases is crucial for prompt diagnosis and treatment. One of the most common symptoms is fever, which indicates the body's immune response to fight off an infection. Coughing can be a sign of respiratory infections like the common cold, flu, or pneumonia. It helps expel pathogens and mucus from the lungs. Rashes, hives, or other skin changes can be a symptom of infectious diseases like measles, chickenpox, or Lyme disease. Gastrointestinal symptoms like diarrhea, nausea, vomiting, and abdominal pain can indicate infections like gastroenteritis, cholera, or food poisoning. Being aware of these early warning signs can help healthcare professionals quickly identify and address infectious diseases. Diagnostic testing is crucial for identifying the cause of infectious diseases. Common lab tests include microscopy, cultures, and molecular techniques like PCR. Healthcare providers also rely on recognizing characteristic symptoms and signs. Imaging tools like X-rays, CT scans, and MRI can visualize internal organ involvement. Serological assays that detect pathogen-specific antibodies can confirm past or current infections. These diagnostic techniques allow for early treatment and prevention of disease spread. Good hygiene, like proper hand washing and cleaning high-touch surfaces, is one of the most effective ways to prevent the spread of infectious diseases. Vaccines provide immunity against many infectious diseases, reducing the risk of infection and the severity of symptoms. Widespread vaccination programs have been crucial in controlling and eradicating diseases. Isolating infected individuals and quarantining those who may have been exposed can help prevent further spread of infectious diseases through measures like stay-at-home orders, travel restrictions, and the use of personal protective equipment. Proper hand washing is one of the most effective ways to prevent the spread of infectious diseases. Scrub all surfaces of your hands for at least 20 seconds, making sure to clean between your fingers and under your nails. When soap and water are not available, use an alcohol-based hand sanitizer as a quick alternative. Apply a generous amount and rub it all over your hands until they are dry. Cough or sneeze into a tissue or the crook of your elbow to avoid spreading germs. Avoid covering your mouth with your hands, as this can spread germs. Dispose of used tissues properly and wash your hands immediately. Vaccines are one of our most powerful tools for preventing the spread of infectious diseases. By stimulating the immune system, vaccines help the body recognize and fight off pathogens before they can make us sick. Vaccines contain weakened or inactivated forms of a pathogen, which triggers the immune system to create antibodies. These antibodies can quickly neutralize the pathogen if we're exposed to it in the future. When a large portion of a population is vaccinated, it creates herd immunity that makes it difficult for a disease to spread. This protects even those who can't be vaccinated, like infants or the immunocompromised. Healthcare providers recommend specific vaccination schedules to ensure people receive the necessary immunizations at the right times throughout their lives. Isolation separates individuals with a confirmed infectious disease from healthy people to prevent disease spread. This may involve hospitalization or staying home until the infectious period has passed. Quarantine restricts the movement of people exposed to an infectious disease, even if they aren't yet sick. This helps monitor for symptoms and prevent further transmission. Isolation and quarantine measures are enforced by public health authorities to ensure compliance and protect the wider community. Penalties may be imposed for noncompliance. These measures are critical public health tools to control the spread of infectious diseases and safeguard population health. Strict adherence is essential. Antimicrobial drugs are prescription medications that directly target and eliminate the pathogens causing the infection. Supportive care focuses on managing the patient's symptoms and maintaining their vital bodily functions during the treatment process. Monitoring the patient's progress and adjusting the treatment plan as needed is crucial for optimizing outcomes and ensuring the infection is effectively resolved. Antimicrobial drugs are essential tools in fighting infectious diseases as they target and disrupt the growth or survival of harmful microorganisms. These drugs include antibiotics, antivirals, antifungals, and antiparasitics, which allow the body's immune system to overcome the infection. However, the overuse and misuse of antimicrobial drugs have led to the emergence of resistant strains of bacteria, viruses, fungi, and parasites. This growing problem of antimicrobial resistance threatens to undermine the effectiveness of these critical treatments, making infections harder to manage and increasing the risk of severe outcomes. To address this challenge, healthcare providers must prescribe antimicrobial drugs judiciously, and individuals must take these medications as directed. Adherence to infection control practices and the development of new antimicrobial agents are also crucial in the fight against antimicrobial resistance. Fever can be a common symptom, but reducing it with over-the-counter medications like acetaminophen or ibuprofen can provide relief and prevent complications. Respiratory symptoms like cough and congestion can be managed with saline nasal sprays, cough suppressants, and decongestants to make the patient more comfortable. Maintaining proper hydration and electrolyte levels is crucial, especially for illnesses causing diarrhea or vomiting. Oral or intravenous fluids can help with this. The goal of supportive care is to alleviate the patient's symptoms and prevent complications, while allowing the body to fight off the underlying illness. Healthcare providers on the front lines, like primary care physicians, nurses, and physician assistants, are crucial in identifying, diagnosing, and treating infectious diseases. They are often the first point of contact for patients and can initiate appropriate treatment or referrals. Infectious disease specialists have advanced training in prevention, diagnosis, and management of complex infectious conditions. They provide expert guidance to healthcare teams and public health authorities, especially for emerging or rare infectious diseases. Local, state, and federal public health agencies monitor, investigate, and respond to infectious disease outbreaks. They work to implement prevention strategies, coordinate with healthcare providers, and share critical information with the public. Epidemiologists play a critical role in monitoring the spread and patterns of infectious diseases, using data from healthcare providers, labs, and public health agencies. They analyze factors like population density, travel, and environmental conditions to understand how diseases are transmitted and which populations are most vulnerable. The data collected through epidemiological surveillance helps guide the development of effective prevention and control measures, such as vaccination campaigns, hygiene education, and disease containment protocols. Infectious disease outbreaks can cross borders, so international cooperation and data sharing among public health agencies is crucial for monitoring and responding to emerging threats worldwide. Robust public health surveillance systems are critical for early detection and monitoring of infectious disease outbreaks. These systems collect, analyze, and disseminate data on disease incidence, prevalence, and trends to identify emerging threats. Clear and standardized reporting protocols ensure timely and accurate communication of disease information among healthcare providers, public health authorities, and international organizations like the WHO when an outbreak is suspected. Rapid investigation is initiated to identify the causative agent, transmission routes, and at-risk populations. This informs the development of effective control and containment strategies. International collaboration and data sharing among nations and public health agencies are crucial for tracking the global spread of infectious diseases and coordinating a unified response to outbreaks that transcend borders. Effective global collaboration is essential to address emerging infectious disease threats. Coordination between nations, international health organizations, and research institutions enables rapid sharing of data, best practices, and resources. Robust disease surveillance systems and early warning mechanisms help detect outbreaks quickly, allowing for a coordinated and proactive response. Equitable sharing of medical supplies, vaccines, and other critical resources across borders ensures vulnerable populations have access to necessary interventions. International research collaborations accelerate the development of new diagnostics, treatments, and preventive measures by leveraging shared scientific knowledge and expertise. Infectious diseases are a major global health challenge that require constant attention and collaborative efforts to address. Understanding the complex nature of infectious diseases, their causes, transmission, and impacts is crucial for developing effective prevention and control strategies. Ongoing research, surveillance, and international cooperation are essential to staying ahead of emerging and evolving infectious disease threats. Raising awareness of the importance of this issue and the need for a coordinated global response is a key objective of this presentation. Infectious diseases are a global challenge that require international collaboration and coordination among healthcare providers, policymakers, and public health organizations. Effective preventive measures, such as vaccination, personal hygiene, and outbreak monitoring, are critical to mitigate the spread of infectious diseases and protect public health. Continuous scientific research and innovation are essential for developing new treatments, understanding emerging pathogens, and staying ahead of the curve in the fight against infectious diseases.